Good afternoon to everyone. This is discussion 4 of the Go Consumer Louisiana Health Initiative. This discussion is on what library service are you ethically and legally able to provide, what must you report, what you cannot report, and what you cannot say. This is put together under a project by Julia Esparza. I'm David Duggar, one of her assistant PIs, co-PIs on this project as she is traveling today. Again, the basics of this program for the Go Consumer Health is that it's international, available to anyone who can connect through WebEx. It's to promote the consumer health information specialization program that MLA offers, and that has a 12-hour and a 24-hour level, and these discussions do count towards those credits. Those that are in Louisiana through this Go Consumer Health initiative can apply for the CHIS, Consumer Health Information Specialization, for free by going through using this system. And you can see the website that it's available for more information. And this is what the project website actually looks like. For those, when you go and see all of the primary courses that are being offered and the list of discussion group classes, sessions that are being offered. So, and this presentation and grant is available through the National Network of Libraries of Medicine through the South Central region. So today's presenter is Ann Glusker. She is at the National Network of Libraries of Medicine in the Pacific Northwest region, located in the University of Washington Health Sciences Library.
Okay, so hopefully everybody's seeing the sort of brown slide that says health reference in you. Does that look good, David?
Yes.
Okay, great. Okay, so here we go. I'm Ann Glusker. I'm really glad to join you today. The topic of today's talk is health reference in you, and I'm going to focus on some guidelines that we prepared for the American Library Association. I'll talk a little more about that in the presentation. Julia Esparza asked me to talk along the lines of ethics, but she also said it would be fine to present this already existing presentation, which goes a little more broadly than ethics. It also is going to address best practices and then introduce you to some training resources that are on our site that you can use with your staff. So just a little about me. I'm one of the 2 research and data coordinators here at the National Network of Libraries of Medicine in the Pacific Northwest region. I've been a public health epidemiologist in the past, also a medical librarian in a large health cooperative, and I've worked in the public library here as a consumer health librarian. So I'm kind of familiar with coming at these issues from a lot of different angles. So the most complicated committee to describe. So you're probably all familiar with the Reference and User Services Association, which is part of ALA. It has a reference services section, and that section has a health and medical reference committee, of which I am the chair. And if you are really excited to go see the page, there's the link. There's some good stuff on there, just pretty intense link. So when I became chair, actually when I joined the committee, the person that was then the chair, Laura Haynes at the University of Vermont, she and I sort of created an earlier version of this workshop. We gave it at ALA, but we based it on some work that Gail Kwame did, who used to work where I am now working. So you'll see on the bottom of the slides where the content came from Gail. So I'm going to talk a little bit about why it's important to think about these issues. I will introduce us all to the Health and Medical Reference Guidelines if you weren't already familiar with them. I will sort of point out explicitly how the guidelines can connect with best practices of working with patrons, and that is kind of the crux of where you sort of hit some of the ethical issues. We'll talk about that more. I will talk about our training materials. I'll show you some of the reference scenarios we came up with, and then there will be time for questions. Just so you know, the way this is showing on my monitors here, because I'm sharing the screen, I cannot see the chat. So I will go back and look and see what you've done, what you may have submitted there when I'm finished presenting, but also please feel free to write me with questions, and I would love to engage with you on this. So when working with the public, and we're generally talking about the public in this presentation, although this can also apply to working with healthcare providers and others, but generally when working with the public, people are coming in without a lot of experience with doing research, as you might expect. They're often coming in with a particular question about a health condition that they've been diagnosed with or think they might have, but as we've often found, the information they already have probably isn't working for them. And you can sort of see in these points, it's a very difficult position that people find themselves in. They are maybe having intense emotions. They may not be able to speak clearly. They may think that the librarian or library may be able to help them with the diagnosis or help them with things that we can't help them with. So some of the ethical dilemmas come in with navigating that relationship and that very, very difficult transitional time for the patron. So the patron comes up to us and with this sort of very challenging set of issues sometimes, and we as staff may not be comfortable with providing the health information, so we may not always know what resource would best answer a particular question. We may not be comfortable with the language and vocabulary in medical texts. I love this is Gail's thing, the ick factor, discomfort with medical information in general. I mean, there's some icky stuff out there. There's no other way to say it. It can take a lot of time to sort of walk someone through pulling that information into their understanding. And when you're in a busy setting, it can be very hard to be patient enough to give the person that time. Fear of giving the wrong answer, or fear of treading into medical advice. And I think that's perhaps the biggest ethical dilemma, is that when does it become medical advice, and how can you know that you're on the correct side of the line? And another thing is that it's very common that the patron will seem very, very comfortable with the information, and, you know, well, I've seen the doctor and I'm taking these pills and I'm doing this treatment, so where do I move from here? And then when you start questioning, they may actually have been misinterpreting what they're supposed to be doing, or they don't understand quite as much as they seemed like they did. So those are all things that we have to kind of navigate when we're working with patrons. So in response to this, originally, way back in 1992, the RSS section created the Health and Medical Reference Guidelines. There used to be a huge set of guidelines. It was legal and business and medical all combined, but they've been separated out at this point. The current version is number 3, and it's pretty recent, I'm glad to say. And it's meant to be used for all kinds of information staff, so it's not just in public libraries, but in pretty much any setting. And the idea is that it can either be a sort of a, what do I want to say, sort of surprising and helpful document for people that don't get those questions often, sort of something to cling to. But it also can be used for skills development for those of us who do often answer those questions but don't really, what do I want to say, disassemble the different aspects of answering these questions and think about them separately and then put it back together into best practices. The link here is to the guidelines. Feel free to take a look and follow along if you would like. So the way the guidelines are laid out is that they're in pretty much 3 large sections. One focuses on the role of information services staff that I've been talking a little bit about until now, more than the other parts. So staff roles, what training might work for staff, outreach, collection, professional development, those kinds of issues. And then there's a full section on reference transaction. So how to be welcoming, how to show respect to the patron, evaluating information, which we all do every day already, and then taking into account cultural perspectives and special needs. And then finally, and I will talk about this a little bit, there are specific ethical statements that deal with professional behavior, library policies, and users' rights. I also commend to you the glossary, which I think is pretty helpful. So, you know, if the only thing that you come away with today is to sort of take a look at those guidelines, I would be thrilled. So this graphic, I just love this graphic, of course, or I wouldn't have put it in, but I just think it's a great article by Lily Luo that was published in the Public Library Quarterly, because, and it's doing what I'm about to do in the next few slides, which is to take the framework that the guidelines provide and try to operationalize it into the kinds of questions you might ask. The guidelines are only meant to provide a framework. They're not a deep dive. This table is a deep dive. So you can sort of see, like, for example, questions, this is the fourth from the bottom, questions eliciting details about the audience of the information. Do you have internet access? Are you finding this information on behalf of another person? The asking for a friend phenomenon. Would you prefer that I look for research articles or the kind of thing that your doctor would read, or do you want something for you to read? So very, very concrete and straightforward, and you can see how sort of respectful those questions are and how they are not assuming any knowledge on the part of the patron, and so they are not shaming. So I do think this is a great sort of outline. But again, the best practices is a much larger topic, and you might want to look at some other guidelines just to inform your reference practice if that's something that's interesting to you and that you would like to work on. So back after the guidelines had just been created, Laura Haynes and I worked on creating this quick start guide to providing excellent health and medical reference service. So it's a curriculum. It's on the committee page. You're all welcome to download it, use it, change it as you wish, ask us for amendments. However it can be most useful to you, please use it that way. It's based on the guidelines. You can sort of see the points here. I'm just going to give you kind of an overview of it today, but you probably would want to present this information along with some reliable health resources such as medlineplus.gov. And again, feel free to modify it however you want. We would appreciate a credit though. So in the next 7 slides, what I'm going to review is the way that you can express the valued approaches to working with patrons around health issues and how they can be anchored in the guidelines. So creating a welcoming environment is a very, very important aspect of making sure that people feel that they can come to you for good health information. So you want to try to be non-threatening. That is addressed in the guidelines. You want the information to be accessible to the patron, also addressed in the guidelines. You'll see as we go through how this is structured. People needing to tell their story, so they're trying to make sense of their situation. They may need to tell their story more than once and remember that they are not themselves. So I know, again, the idea of today's presentation was to deal with ethics more explicitly, but I would make the case that all of this connects with an ethical approach and a supportive approach to helping people with their health information. In conducting the reference interview, you want to be sure to provide a safe and private place. This can be difficult at the moment, so it's worth thinking about planning that out in advance. Again, privacy is a very strong issue in terms of ethics of helping people, so you can see how this all interweaves. Not judging the person or giving an opinion, but validating their feelings by focusing on the information specifically. Again, a very strong value in our profession, and a helpful way of staying on the right side of the line of not giving medical advice. The next one, of course, do not speak from personal experience or knowledge. We all sort of know that, but sometimes when you're making a connection with a person, it's easy to forget those kinds of things. We can't guess at conditions. We can't give medical advice or recommend specific healthcare providers. And, you know, I think as we read these points, we're thinking, well, of course, I know that. I would never do that. And we all know that we're not supposed to, but then it's very easy to find yourself after an encounter feeling like, oh, maybe I did stray a little far down the line there. In my time at the Seattle Public Library, there was a particular person who was quite pressuring about trying to get us to give names of providers. And we had this beautiful, beautiful article that was, you know, Seattle's top doctors, and it was all ranked and rated. And it wasn't enough, but we had to hold firm. So we've all been in situations like that. So when you do get that pressure from a patron, it's fine to say, I don't know, I can't get that information for you. So again, this is good boundaries and good reference practice. We will not cross an ethical line by trying to get what the patron is asking for if it's not appropriate to give it to them. And you may, the patron may be very disappointed if you refer them back to their provider, but as we all experience when we see our provider, sometimes your mind kind of goes numb and you come home and you're trying to tell somebody else what happened in the appointment and you realize you didn't quite get all the information. So it happened to me several times at the library that a colleague would say, well, you know, they say this and the provider told them this, and I would have to remind them, we don't know exactly what the provider said, and we don't know exactly why the provider told them to do that. You can certainly print out for the person lists of questions to ask a provider, but it's a delicate relationship into which we should not insert ourselves. And that may come down to just being very clear about what library staff people can do and can't do. And again, all of this is addressed in the guidelines. But if you're training staff, the guidelines are written in guideline speak, and so these kinds of translations may be helpful. We've talked a lot about supporting the user. I don't think I need to go into that more deeply right now. Eye contact is very important. Often there's a lot of shame and resistance to talking about their conditions, but the librarian may be seen as the last attempt at getting good information, so to be welcoming, eye contact is very important. Body language and tone of voice is very important, and again, finding a private place. And then clarifying their health information needs. I think the earlier slide that had the specific questions about, you know, eliciting who they're asking for help for, you know, that huge list of questions. They're all fantastic for clarifying the information need. And focusing on the information need is what we ethically are supposed to be doing as library staff. Oops, sorry, wrong direction. So we've kind of looked at this already, but these questions are kind of helpful. You have the who, what, where, why, how. And one aspect of asking these questions is if you've done some researching in advance about health resources that you would use to help the person, you're in really good shape. So for example, I remember a time that a gentleman came in that was about to have knee surgery, and he just kind of wanted to know what was going to happen in the surgical procedure. And so we really did focus on those last three questions. I was sort of like, well, you know, medlineplus.gov will have videos of a knee surgery and we could find the one that you're going to have and take a look at that video, but is that too much information? Would you rather have a written description? But he wanted the video, and he had obviously not had the procedure already, and then when he saw it, it was exactly what he wanted. So the methodical approach that we generally use to answering reference questions works just fine for health questions. I've spoken a lot and could speak much more about being sure to direct people to reliable health information. So some of this will require sort of a priority for making sure that you explore resources in advance and perhaps get additional training for staff. Medical terminology can be very helpful, and it doesn't have to be super intense. You could even just kind of make up a cheat sheet like NEPH, nephrology is probably going to refer to the kidneys, that kind of thing. For patrons, you want to give them a range of options, but you don't want to bombard them with what you actually end up giving them. Like you could say, well, there's all these things to choose from. Let's look at the one that works best for you. I will print out this one article for you or these 2 articles for you. Explaining to them why the resource is suited to them is also best practice. That can be a little bit challenging if they're asking for information based on healthcare provision that maybe is not evidence-based. We could have a long discussion about that too. That's a very interesting ethical question. The one that happened at Seattle Public Library that I sort of came up upon was being asked to provide information about the HCG diet, which is human chorionic gonadotropin, and it's a discredited diet, but people still ask questions about it. So do you tell them it's discredited or do you not, and et cetera. So anyway, just to get back to this, we never interpret information or make recommendations, as tempting as it may be. What would you do is going to be a very common question from patrons, and you need to have an answer for that. Excuse me one second. Okay, so so those were the basic overview of what you might use to develop a training. Because of our time today, I didn't go into great depth with those. But you can sort of expand on them or not as appropriate for your audience. You might want to combine them with looking at resources. Excuse me again, just having some tea. So you know, you would use the slides that I just showed and then sort of start delving into resources that people might want to use with patrons. But then we also have these quick start guide training activities that are more kind of like small group activities where you look at a reference scenario and tie your potential response back to the guidelines. And these can get into some really interesting ethical discussions too. So I'm going to show you the first one, and then we'll flip through the later ones, but just to get a sense of how you might do this in a training. Sorry about this. So there are 5 reference scenarios. Here's the first one, and just so you know, they all happened to me at the Seattle Public Library. A little bit challenging. So a patron calls, wants to know the symptoms of stroke. You read her information about stroke symptoms. She says that she thinks she's had a stroke. She wonders if you think she's had a stroke. And she also wants to know the symptoms of Japanese encephalitis. So in a training, you know, the group would have this scenario, and then they would have these discussion prompts. And you know, I would like to focus today on how did the guidelines inform your response and behavior, which guidelines might apply, what issues would arise for a staff member. So a lot of these kind of discussion prompts could be helpful in focusing on ethical issues if that's a focus that you'd like to have. So certainly in this question, ethically, of course, you would never discuss whether you think that she has had a stroke or not, you would be referring her back to her provider for more information. The informational question about the symptoms of stroke, it would be fine to present the symptoms of stroke if that's the informational question, because that's something that you could get from medlineplus.gov and tell her about that resource. You could also give the symptoms of Japanese encephalitis, because again, that's a very defined informational need. The challenge comes when you have to sort of decide how to maintain the bond with the patron and yet not answer the question in the way they want it answered. So moving on to the other reference scenarios, a patron calls from a nursing home. She says none of the staff there will help her. They hate her. They're giving her the wrong dosage of her drugs for her blood pressure. She wants to know the right dosage and the billing code. So this was a challenge. This was one that I kind of walked in the middle of, and the librarian was trying to actually answer all of these questions because they seemed informational. So, you know, what is the dosage of X drug for blood pressure, high blood pressure? That does sound like an informational question, but the point of this one was that you're kind of straying into the territory of giving medical advice. You don't even really know that this person has blood pressure, high blood pressure. The person can't even say the name of their condition. You're just wading into some very, very challenging territory. So, you know, at that point I was sort of encouraging the librarian to kind of get more into finding her other sources of help. But it certainly was a challenging situation for the librarian who felt that she was not able to help the patron the way she wanted to. Reference scenario 3, the patron has had a friend just been diagnosed with Huntington's disease, and you print out the definition for her from the Huntington's Disease Society of America website. How do you engage with this patron around the fact that she's just gotten this very difficult information? Again, especially in public libraries, there's the informational piece and then there's the relational piece, and that the conflict between those two can sometimes create ethical issues. Scenario 4, I have to tell you in this case I did go do something that might be by the guidelines considered unethical with this case. 92-year-old woman had high blood sugar, said her doctor told her that if her next blood sugar was high, they'd treat her for diabetes. The doctor told her to cut out gluten. She wanted to know if she could just cut out strawberries because they have a lot of sugar. And so again, we don't really know what the doctor told her. We don't know what her understanding was of what the doctor told her. But there was a lot of confusion, and the thing that I did that I probably should not have done, but I thought about it and then just decided, oh well, was I asked her if she had seen a nutritionist or had that been mentioned. And I said, often people with these kinds of questions find very good help from a nutritionist. They didn't go further than that, but I probably shouldn't even have gone that far, but oh well. And then reference scenario 5. Nursing student needs help with assignment. She's supposed to be talking about the lived experience of multiple sclerosis, requires a literature search. Her sister has MS. How can you help with the literature search? So this one, again, you know, a lot of these focus on the delicate balance between the information needs and the relationship with the patron, and that's, I think, where the ethical piece often tends to come in. So anyway, those are the reference scenarios, and that I have to say we've had pretty good experiences with them generating some interesting discussion. So now that we've sort of talked about the guidelines and how you might use them in training, feel free to put something in the chat if you'd like, or just think to yourself what kind of techniques or practices might have come up that you are sort of, maybe you've heard of them, but you've been thinking about it but haven't really decided to take the time to really delve in a little more. Anything new to you, anything you'd like to try, either with training staff or helping patrons. Do you think the guidelines can serve as a good basis for you, creating a new approach as you work with health information with your patrons? Are there any supports that you feel would be helpful to you? For example, suggestions for a good medical terminology course or text or that kind of thing. Any other resources you might envision needing? Excuse me. We'd love to hear about them. We'd love to help you sort of connect up with the resources you need. So please do stay in touch about that. And then here are some resources to consider connecting with if you do decide that you want to delve into this area a little further. The guidelines link is here. The committee link is here, where you can find the quick start guide and the scenarios. Also some very basic web links for helpful health resources. So I work for the National Network of Libraries of Medicine, as I mentioned. It's an arm of the National Library of Medicine that brings us all PubMed, but we do outreach, and we have some really good collections of resources. The topics link is helpful, and also free classes like this one. The range is really unbelievable, so I strongly suggest you take a look at that, but you probably have if you're working on your CHIS certification. Medlineplus.gov, I'm hoping we're all familiar with that, but if not, I just want to say a quick word about it. I'm about actually to go present at the Washington Library Association, which is mostly public librarians, and whenever I've presented at that kind of conference, I say to people, well, are you familiar with Medline Plus? And they're like, well, I've heard of it. So my line is, well, it's like WebMD, but it doesn't have any ads, and all of the resources have been vetted by librarians, so you can trust every single link. So that tends to get people's attention. The other piece that's great is that back at Seattle Public Library, people would give patrons stuff from the library databases, but to get to them from home was sometimes a pain, or they didn't actually have a library card. MedlinePlus.gov does not have that limitation. Anybody can look at it. It looks great on a mobile device. It's got broad content. It's in Spanish too. So it's just great. So if you're not familiar with it, take a look. Also, there's this wonderful consumer health toolkit for library staff. They are working on updating it, but you might want to take a look at this. And then finally, those of you that are not in the Medical Library Association, and most of my public library colleagues were not in the Medical Library Association, there's a section, the Consumer and Patient Health Information section, and the first link there, the MLAnet.org link, you probably can't get in if you're not a member, but they have started a Facebook page, so worth following that. And then here's my contact information. So thank you for spending this time with me. I will close the slideshow so that I can then see the chat box. Okay. So I'm seeing a question from scenario number 4. Let me just turn to that. So that was the blood sugar one. I'm assuming everybody can see the chat box, but the question is, scenario 4 did not mention weight, but would you turn the discussion with the patron about books that mention calories or nutrition, things from Weight Watchers or other local groups or organizations that have cooking and food guides that might help? I like this question a lot because I feel like I see that, I don't know whether it was Julia or David that asked this question, but I see you sort of thinking ahead and looking for the best ways to kind of like parse the question to make sure you're getting the information to the patron that they need. But the thing that concerns me a little bit is that it's going a little far away from the way the question was asked, and that may be that I didn't communicate it well enough in the scenario, but that it was the woman was calling on the phone. She's 92 years old and in a nursing home. So in that particular case, I think I probably wouldn't have suggested those things because I think it wouldn't have been something that she could have pursued. I'm also a little nervous that when she says gluten and diabetes as her concerns, that weight isn't necessarily what she's mentioned as a concern. But I don't think we have to be perfect either, to be honest. I just think that if you do your best, and people will tell you if you've gone in a direction that they're not interested in, they will definitely tell you. So yeah, hopefully that answers that question. Anything else I can help answer or address?
So Anne, can you also click on, do you see also the question and answer button also? Because
Oh, thank you.
there's the, I've
I got out of,
been technical things, but
okay, so the only question I see in there is, am I the only attendee here? And the answer to that question is, hopefully not. I'm seeing that there's 11 attendees, so hopefully that is true. Okay, well, I think I can wrap my part up yet. I'll stay on the line till the end of the hour in case anybody comes up with anything else, but I really appreciate your attention. Thanks.
okay, so
take it away, David.
Okay, so I'm going to go ahead and change that over to show our final slides and information for those about the credit. Okay, so I want to thank Anne Glusker for her talk today, and let you know that 2 weeks from now will be discussion number 5, how can your personal beliefs affect your information interactions? And that's going to be by Catherine Arnold Smith, who is at the University of Wisconsin in Madison. And again, for those who were asking about the slides and the recording of this, because the session is being recorded, and a transcript will be made of it. It takes about a week or 2 for the transcript to be made, but that will get loaded onto this website that you're seeing here that says HTTP guides, LSU, Go Consumer Louisiana. And under the section there on the website that actually says discussion, it'll be there under discussion 4. For those wanting to get the MLA credit, if you go to this link at tinyurl.com, go consume-assessment-4, that should take you to it to give us your feedback and such. And if you have questions, you can definitely send them to Julie at her email. She will be out for about a week or so because she's off to AMNC and Oslo meetings, but she will be seeing her email. So if you have any questions at all, feel free to send them to Julie about the recording of the session, but this will come up. It may be around the 15th before it actually gets loaded up based on her being out for a little bit, but we will have a recording that will be transcribed, and the slides will also go up as well. Show the tiny URL again. Okay, let me go back and go back to that slide. I'm going to go back and share that slide one more time also, but I've typed the tiny URL into the question answer box as well. Let's pull up the slide. So hopefully you can see, again, this current slide, those that had questions about tinyurl.com. I want to thank everyone who logged in today. I think it was a great group. We had 11 attendees. Thank you, Anne.
You're very welcome. Glad to join you. Take care, everyone.